any student groups, that's a big recommendation. Like that's where you start to build your network. Like for me, I have no one in my family who's in medicine, and I was able to build myself here in the UK from just joining whatever society or whatever. The university sends these mentor schemes. That's how Atousa and I met.
Yeah.
And with joining all these different things, that's how you get more exposure. For me, it was because it's something I just wanted to do. I can't say why, it's just something that I just fell for, and I just kept doing things, and by doing more things you develop a passion for it. Like passion is something I was always confused about. Like they always say follow your passion, but passion develops over time from doing things continuously throughout, and that's what I did. Like in universities from day one, started Surg Soc, and I got involved with all the things like anatomy daily, and that built my love for it, and then suturing, and then just continued to build up, and then allowed me to go into different hospitals and like shadow doctors and stuff.
Hey everyone, how's it going? So today's guest is going to be Kayleigh, who is a fourth year medical student at the University of Birmingham. So Kayleigh and I met through our university's surgical society, but we're also working in collaboration with some of the videos that you've heard me mention on this channel. And we thought it'd be a good opportunity for us to kind of like chat and talk to you a little bit about some of the things that we consider as medical students who are hoping to go into surgery, but also just having a bit of a chat about life in med school in general.
Yeah.
So, Kayleigh, do you want to just like introduce yourself and then we can take it from there?
Yeah, so like I just said, my name's Kayleigh. I'm a fourth year medical student here at the University of Birmingham. I'm actually an international student from Trinidad and Tobago, and I am on committee with Atousa as one of the surgical skills reps.
Amazing, okay. So we were just having kind of like an extensive conversation like off camera about being a medical student and how we develop our interest in doing surgery. Mm-hmm. So I think you've heard me talk about this previously in the channel, but Kayleigh, do you want to like tell us a little bit about what it was like starting medicine for you? What got you interested in like wanting to pursue surgery? Did any other specialities like pique your interest, etc.?
Well, for me, it would have been my shadowing experience back in Trinidad. I was able to go to theatres and experience it there, and just from there I just fell in love with the ability to just I love always being on my feet, and and it's just I kept on that path. So that's why when I joined medical school, first thing, joined the University of Birmingham Surgical Society, and then from there I just progressed, continued whatever the society held. I went to all their things, and with that I built my love for surgery. And in terms of other specialties, I fell for other things like anesthetics. Like I do enjoy them. It might be a possible route in the future, but I guess as time goes along and I get more involved in it, then I'll decide later on. But in the meantime, just enjoying what I study at the moment.
Yeah, definitely. And you know what, it's really good that you mentioned about like joining a society at university, because I was a bit of a late comer to this. So I only joined our surgical society in the 5th year, and a part of me was like, I kind of wish I joined sooner, because amongst my other medical friends, maybe outside of the society, I only know maybe 1 or 2 people who want to do surgery. The majority of my friends are like die-hard medics, which I love. But it's been really nice to like meet other students who have a similar interest.
Yeah, it is a nice society to join. And any student groups, that's a big recommendation. Like that's where you start to build your network. Like for me, I have no one in my family who's in medicine, and I was able to build myself here in the UK from just joining whatever society or whatever. The university sends these mentor schemes. That's how Atousa and I met. Yeah. And with joining all these different things, that's how you get more exposure.
Yeah, that's true. Do you mean how you Miss Cuhna met through the mentoring?
Yeah, I'm Miss Cuhna.
Yes. So again, you may have seen like a video with Miss Cuhna. So she is both of our mentors, I guess. Very much like a mentor and like helping us with like education and stuff. Do you want to tell us a little bit more about that mentoring scheme?
Yeah, so the mentoring scheme, it was sent from our university email, and I just applied for it. There's a lot of these that goes around, and I just apply for them, and that's how I build my network. Other ways you could build a network would be actually going into the hospital and meeting people, but I find that a bit difficult because people tend to be a bit too busy sometimes, but when you know that they want to actually help, it's just easier. So that's one of my recommendations. Any mentor scheme that you can find, sign up for it. It's worth your while.
Yeah, definitely. And I know what you mean. I think sometimes when people don't expect you and you're asking them for help, they're kind of a little bit confused. And my experience has been that most people are generally more than happy to help, but it's just catching people at the right time. And this isn't just at Birmingham, is it? I think most universities will send out newsletters. So is that how you found out about that?
Yeah, I found out from our newsletter.
Yes, and that will just like, sometimes they match you to somebody who like they think would be a good fit for you. So is that what you had to do with Miss Cuhna? Did you like type in a couple of general interests and you were introduced?
Yeah, it was like Google sheets, and you just clicked on which specialties you were interested in. But there's also, if you can't find that mentor scheme, you could actually develop it. Like I know there's an international scheme where they found doctors and who were interested in helping other students and build that cohort of staff who wants to help, and then send it off to students. So that's another option to help other students and then yourself in the process.
Yeah, definitely. And I think that's a really good thing, because sometimes it can be quite nerve-wracking, and you know, obviously everybody in medicine is very different. You do find people who are a bit more, I don't know, extroverted, or who can very easily just go up and be like, can you be my mentor?
Yeah.
So I think if you're somebody who might not tend towards that, it's okay. There are still lots of other ways that you can get in touch with people, like through these schemes.
Definitely, because I didn't know anyone here, and that's one of the ways that helped me like put my foot into the special, getting into surgery.
Yeah, exactly. And so did you join Surg Soc because you wanted to explore, or were you like, no, this is what I want to do? Because I know different people come at it from a different perspective, don't they?
For me, it was because it's something I just wanted to do. I can't say why, it's just something that I just fell for, and I just kept doing things, and by doing more things you develop a passion for it. Like passion is something I was always confused about. Like they always say follow your passion, but passion develops over time from doing things continuously throughout. And that's what I did. Like in universities from day one, started Surg Soc, and I got involved with all the things like anatomy daily, and that built my love for it, and then suturing, and then just continued to build up, and then allowed me to go into different hospitals and like shadow doctors and stuff like that.
No, definitely. And actually, I've been to your suturing sessions. So I came to a session where Kayleigh was teaching me how to do suturing and tying knots. So was that a bit of like I don't know, like a bit of a surreal experience for you to think that, oh my god, like I started in first year and I was learning and now I get to teach other students.
Yeah.
What was that like?
I remember in year one when I went to this teaching session and the year fours were teaching me, I was just like, wow, they're so cool. They're teaching us how to do these things, and like I wanted to be like them, and then now here I am, I'm helping other people suture.
Yeah, no, it's again, I'm laughing because again we were talking about this off camera, that we were saying, you know, when you start medical school, you look up at everybody and you're like, wow. And now I'm about to be a doctor in like less than 6 months. Kayleigh, you've got a year to go. Fingers crossed, you'll be absolutely fine. So yeah, it's quite interesting in that sense. Do you want to tell us a little bit about like just yourself in general, as in what was it like to come to the UK and start medicine, and what was all of that like for you?
Well, from Trinidad, my main goal after I graduated, get into medical school, and I just didn't know where I wanted to go. I could have stayed in Trinidad, but I had the opportunity to come here, so I just took it, and coming here, it just opened my options for other things, like getting into research and stuff like that. And yes, it was a difficult transition in the beginning, but I built such a great group of friends who just helped build me up and push me to do things. So that's one other thing I'd recommend: get that good support system wherever you are, and just continue going with it.
And I guess for somebody who's like just about to embark on this process, what kind of advice from your experience would you say that would be good to get started with building a network, whether it's like a professional network? I mean, we talked a little bit about that, didn't we, with mentoring, but maybe about like social networks and stuff.
Yeah, like if you're starting university, just actually attending lectures and sitting with
honestly, it makes a bit like most of your friends are the people you end up like sitting with every day. Yeah, that's true.
Yeah, you just sit with a new person each day. You might like bond with one of them, you might not bond with someone else. Just sit there and then joining different societies, like we said, and staying in for lunch and like going to MedCaf or whatever cafeteria there is at your university, and just the more people you smile at, the more likelihood to find your people.
I love that. The more people you smile at, the more likely you'll find your people. I love that. That's so true. It's so true. Okay, so I guess in terms of, this is something I was like asking Ms. Cuhna as well before you were filming the interview. In terms of medical school so far, are there any like particular highlights and or lowlights that you think would be good for us to talk about, so other people can kind of learn from it and consider them as well? Look, let's start with highlights. Let's start with a positive note. Yeah, let's do it.
My highlights would probably be, like I said, the network that you build. Like, we all go through this intense period before exams, but somehow we build this camaraderie and just like work together. The people you meet in medicine are some of the most amazing people you'll meet, and that would be my biggest highlight, I would say.
I think I would agree with you. And just to add on that, actually, so I think we were both affected during the times of COVID in different years. But you know, recently we did our Surg Soc conference again. There's like, I made a little video about that. But that is my favorite thing that I've done in med school. Listen, it was stressful. There was like a lot of moving parts, and you know, you don't realize what it takes when you go to an event. You don't see all of the behind the scenes. But when I reflect back on that experience, I just think it's a camaraderie that you said, because there's a group of students putting on an event for other students, and everybody's working really hard, and you're communicating all the time, and you make really good friends and you bond. So I don't know about you, but that's like, I'm sure because you've done the other events as well. Like for me, it was like such a positive experience. Yeah, it's always stressful, but then it always is rewarding when you see the participants at the conference and they're really enjoying like everything you worked so hard for is worth it. No, definitely. So yeah, that's a really good experience. Okay, so in terms of like some of the lowlights, then what would you say?
For me, I guess it would be the amount of content that we have to learn in short periods of time. It can be intense, but if you, like we said, slow and steady wins the race. If you start early and you continue with it, eventually things get better. But it's still a bit difficult, I'd say. But I think that stems into my other low light with imposter syndrome. Which we mentioned before.
Yeah, I mean, let's talk about that actually, because we had like a really interesting conversation about imposter syndrome within, I guess, females in surgery. But there's a lot of imposter syndrome just as students.
Med students, I guess it's just we have this pressure that we put on ourselves trying to be the best of the best, because also if we aren't the best of the best, a lot of bad things could happen. But I think one thing we need to remember is that we're very supported in our profession, and it's not just you alone, like what they always say, the multidisciplinary team. So that's something we should always remember. That's just be one outlook I have at it.
Definitely, and actually, when you were saying about like bad things happening, like there are consequences obviously if you don't attend your lectures or if you don't do that. But my experience has been like the perceived bad thing is often like way bigger than what actually the consequences are. And I think as medical students, or just students in general, like you have a bit of this like intrinsic fear of, oh my god, what's gonna happen? And like I'm trying to see how I can phrase this. Like I've spoken to some of my friends where they have had to resit exams, or for myself personally, like I was convinced that I had done really well on one project and actually my mark wasn't reflective of like what I thought. And when you have those experiences, there's that initial hit to your ego where you're just like, oh no, like what? But then actually, I think you get over that and you're like, actually that wasn't that bad. I managed to pull myself out, you know, take on the criticism, work on what I needed to do, and then sort of like move on from it. Or I decided this isn't that important to me and I'm just going to let it go, you know. And I think some of that, particularly for me, I think now that I'm in my 5th year and like my big finals are out of the way, I just have my final exams left. There's that sense of like, I don't know what's important to me. At the end of it, like we're all going to be doctors, and you know the grades are important and stuff. But I think, I don't know if you felt that at the start of med school there was a lot more. I need to do this. I need to get the top. But then you sort of like mellow out with time. And
then you experienced a bunch of. You started off with you did a undergrad in biomed, and then you did your masters. I'm doing
I'd be old. Like, I've had these years. Yeah.
In terms of advice for us, like I guess you have more experience with the studies and stuff like that. How any advice for us who this would be their first degree and getting accustomed to life and stuff like that?
Oh goodness, I like how the interviews are about really. No, it's fair. It's fair enough. Let me have a think. I mean, the only thing I can say from my own personal experience and what I would say to anybody who, this is your first degree, is like, yes, study, yes, put good habits into place so that it sort of snowballed. But I always, like, I don't know, like my experience with a lot of things is that like the best things in life happen sometimes when you step out of the way a little. I think whether it comes to my studies or projects or whatever, whenever I'm like too like controlling and I need something to go a particular way, I mean, you end up burning yourself out, and I think imposter syndrome gets so much worse. And I think sometimes if you just like step out of the way and like let life happen, you forget how much you pick up. Like I'll give you an example, because this was like a big whoa moment for me. So as fifth year students, we get the opportunity to do something called near to peer. So we get to teach third year students. And I had this like a really lucid moment where it was me, another fifth year student, and I think 4 third year students. And me and my fifth year fellow were doing like bedside teaching. And we were teaching them how to take histories and examinations. And I had this moment where I was like, you know, I vividly remember not knowing how to do a history, not knowing how to do an examination. And all of a sudden now I do. And I'm not really sure what happened in the middle. But like, it just does. Like, what, you know, sometimes like you don't take account of your progress, and then you look back and you're like, oh, I'm good at this thing that I used to be terrified of. Like, the gap closes. I don't know if you've had that too.
Yes, like in year 3, I was trying to memorize the steps in the for the examinations, and now I'm just like, okay, I know it. I just have to do it.
Exactly.
So it's just, I guess, time and practice.
Yeah. So when I started GEC, one of our supervisors would say this, and I would find it so frustrating. What was it? It was just like, just trust the process. And then, like, right, that is the least helpful thing when you're starting off and you're stressed and you have like a billion things to remember. But now I look back and I'm like, damn it, he was right. There is like a natural process that kind of like happens, and I guess just to relate it back to, I guess, medical students interested in surgery, I think the same thing happens, because the first time I remember I had to scrub up to get into theatre, I was putting the gloves on wrong, like the gown was backwards, like this like nurse was like looking at me like, do you want some help? I was like, yeah.
I grabbed the tissue from the side of the wall. Don't do that.
Don't do that. Yeah. But then like now, you kind of, I don't know, you don't have to think about it, like some of that just kind of comes, which is really nice.
Yeah.
But no, it's a funny process, isn't it? So should we talk a little bit more about, I guess, med students' experience of wanting to go into surgery? Yeah. So I think we talked a little bit about having network, having other friends that are, you know, around you who are interested in the same thing. Again, some of our off-camera discussions were about, like, myth busting. I think Kayleigh and I have both had experiences where I'm sure they were well intentioned, of like comments like, oh, but you're too nice to be a surgeon, or don't you want a family, or you know, some of these things. So do you want to speak a little bit about your experiences with those and how, as medical students, as a group, we can kind of like combat?
Yeah, well, for me, I've had experiences where people would be like, you have to have this cool heart to be a surgeon, to be the best of the best, and like, as a med student, you want to be the best, especially for your patients. And I was worried because I can't be that cold-hearted and not be having that care. I want to say we all should have compassion for patients, but the way to, how do I phrase this?
Warmth. Like there's a certain warmth
that we have.
Yeah.
And they said that with surgery, you need to be able to withdraw from that, be able to withdraw from it quickly. And I didn't like that. I never resonated with that, because I want to be there for the patient throughout their journey. And then that's another thing. They say that with surgery, you're not there for the patient's whole journey, but you are with them in that process. And I've been lucky to make the acquaintance with a lovely surgeon, Ms. Cuhna, who is one of the sweetest ladies I've met, and she's an amazing surgeon. And because of getting experience and meeting all these different new people, it reminded me I could still be true to who I am and continue with this profession. I don't have to go with that stigma of being that cold-hearted, like, surgeon.
Yeah, no, I completely agree with you. But the thing is, like, that is normal for some people, and that's brilliant, you know, like that. Like, some people just do have a bit more of, like, I don't want to say detached, but, like, you know, people have different demeanours, and I think perhaps we're quite similar. So I think I tend more towards, you know, being a bit more, I don't know, like, softer spoken, I suppose. And, like, for some time, that played into the imposter syndrome of, like, just because I'm a bit more soft spoken, does that mean that I'm not suited for this speciality? But I think Kayleigh and I both agree that, like, you need one mentor, okay? I mean, like, having a team, a vast team, is great, but you just need to have, like, one person to go, do you know what, like, they're doing it.
You can do it.
Yeah, and we can do it. And I think that's something I say in any video, any advice is, like, find a mentor. And then let the process sort of happen.
Yeah, I've had someone giving me advice, like, find someone you see yourself in, and you can see you becoming like them, and they're the best persons. I know it's easier said than done, but like I said, the more you smile, the more people you meet.
Yeah, no, I love that. And actually, like, I don't want to kind of, like, exclude like, the boys in the women in surgery or, like, the women in medicine conversation either. Again, something we were talking about earlier. Like, I've got some, like, male surgeons who I very much look up to as mentors, you know, because they've got their own, like, work and life and family or whatever, and again, it is, like, very admirable. So I don't want to be like, you have to find somebody exactly like you.
Yeah, it doesn't have to go with the gender roles and stuff. Like, there's a male surgeon I've met who is in orthopedics, and he's one of the sweetest men I know, and I was amazed because I know that stereotype they're the same, but he contradicts that. So I think it's just a battle against that stereotypes, really.
Yeah, definitely. Right, so I'll ask a couple of, like, end practical questions. So, like, let's say there are medical students watching this, or even, like, maybe junior doctors at the start of the level, who are starting to develop an interest in surgery. What are some of the things that you think we can, you know, get started on to sort of help in the process and help get exposed to surgery and help with the portfolio, etc.?
Okay. Portfolio. Highly recommend looking at the core surgical training handbook and look at the checklists, and from there you can start to see how to develop points, and then from there it also gives you, like, a sense of direction on what you need to be doing, like, and also develop another like a interest in things like research. They tell you what, like, audits to do or oral presentations and stuff like that, and from that you could go ask surgeons or stuff like that if they have any projects that you can assist with, and then you develop an interest with that by reading up more about it and assisting with that projects, and then by presenting it. So that also piques your interest as well. So,
can I ask a question about that? Were you intimidated the first time you opened that document?
Yes, it's a big document.
Yeah, it's a big document, and I bring it up because, again, I've spoken to people who have said, like, oh, I'm interested in surgery, but, like, it's just too competitive and I don't want to do that. The thing is, like, yes, it's competitive, but, like, once you start,
you have fun with it.
You have fun with it, and also, like, it snowballs, you know. So if you're one of these people, I'll link the document below. If you open it and freak out, I freaked out. I don't know if Kayleigh freaked out, and
my whole housemates freaked out when they opened it.
Yeah,
everyone freaks out when they see it
because it's so overwhelming. But then, like, once you actually start breaking it down and just realize that you have years. You know, you have, like, if you start in med school, you have a long time to do it. So don't look at it and go, oh, I can't do that, it's too much.
And even if you're in 40 or 50 and you think you don't have time, you have your junior years to more than well do it. And you probably have better resources there where you're actually in the hospital and you know the seniors to help you.
Absolutely. And another piece of, like, reassuring advice that, like, I received. So I met up with this she was an F2, sorry. She was a surgical trainee. And I asked her, oh, like, you know, when did you know you wanted to become a surgeon? She was like, oh, in my F2 year. And I was like, really? And she was like, yeah. She was like, you know, people tell you that if you want to be a surgeon, you have to know from, like, day -0, like, sorry, -1 that, like, you want to be a surgeon. And she was like, no, like, I wanted to follow one path. And then in my F2 year, I was like, no, actually, I'm interested in this. I took an F3 year, built up my portfolio, got in, and now she's a general surgery trainee. So it's good. Like, that was, again, reassuring for me to hear, to go, oh my god, so, like, I didn't need to start yesterday. Like, you can start from wherever you're at. So
yeah, I guess, like, the summary of this is that don't worry, wherever stage you are, you can always pick yourself up and get into surgery at any point, really.
Yeah, absolutely. Okay then, so what other pieces of advice would you give? So the first one is, like, look at the document, get solid portfolio. I think we said about
we said about the networking, the actual skills itself. Either attend courses and stuff like that, or simply on YouTube. You can literally just open a YouTube video, buy the stuff on Amazon, and you can practice on like bananas, oranges, and stuff like that. Like just get to build that dexterity in the fingers and stuff like that. It's just to have fun with it, really. Like, what's the phrase we use with the smooth?
Oh yeah, again, right, this has become my new favourite quote, that like, slow is smooth and smooth is fast. So whether it comes to like your portfolio or networking or skills, like, don't feel this urge to like do immediately, quickly, you know, to get it kind of done, because it's so easy to fall into that mentality as a medical student.
Yeah, you get overwhelmed.
I get overwhelmed because, as Kayleigh said, like, you know, some of my colleagues, obviously yourself included, are some of like the smartest, most interesting, like well-versed people you'll ever meet. But then you have to remember that, like, so are you. If you're watching this, and even if you're not on medicine, even if you're like just interested in like science or surgery or medicine or whatever, just think like, you are a very interesting person, okay? So don't just look at other people and go, wow. You know, sometimes like you don't see those things within yourself because they're familiar. So yeah, slow is smooth and smooth is fast. That's gonna be on my wall quote, Atousa's wall quotes. But yeah, so is there anything else you want to share, Kayleigh, just with any other medical students or people interested in medicines, research, science in general?
I would say, like, most of this talk was about, like, don't fall into that hole when there's a certain stereotype. Like, we've seen from many amazing figures, you can break the stereotype. And just because no one else has done it doesn't mean you can't do it.
Yeah, absolutely. Oh, I think we had a really good chat there. Obviously, if you have any other questions for Kayleigh and I, like, we're continuing to like work on these like video projects and stuff, some more of it off this channel, but I can refer you guys to as and when they come up. But thank you so much for coming and having a chat with me.
No problem.
And yeah, if you have any questions or anything for us, then leave them in the chat below.